If you are over 60 and still touching yourself the way you did when you were 30, you could be slowly destroying your erections, your prostate, and even your nerves without realizing it. I've seen men lose their sensitivity, struggle with painful inflammation, and quietly wonder what went wrong, all because no one ever warned them that the rules change after 60. That's the shocking truth most men never hear, and it's the reason I am asking you to listen carefully today. My name is Dr. Mohit Khera. I'm a board-certified urologist and men's health specialist with more than 3 decades of experience. Over the years, I've sat across from thousands of men your age who came to me embarrassed, sometimes scared, but always looking for honest answers. This is the conversation I've had behind closed doors in my clinic, and today I'm bringing it out into the open. Because here is the paradox. Masturbation itself is not unhealthy. In fact, it can protect your prostate and circulation. But the way most older men do it is working against them. What feels harmless in the moment can quietly create damage that makes intimacy harder and recovery slower. That's the hidden danger, and it's why so many seniors end up frustrated. But there is good news. In this session, I'm going to give you the exact roadmap for safe, satisfying self-pleasure after 60. I'll show you the 3 critical mistakes to avoid, the proven method I teach my patients, and the warning signs that mean it's time to see a doctor. And stay with me until the end, because I'll reveal the one subtle symptom during masturbation that could be your body's first whisper of a serious underlying problem, a warning you cannot afford to miss. Before we get started, make sure you subscribe and turn on the notification bell so you won't miss any of my future men's health guidance. And if you find this topic helpful, drop a 1 in the comments. If not, type 0 so I know how to improve these videos for you. Now let's begin with the first and most important truth. Masturbation after 60 is not dangerous in itself. In fact, it can protect your health. But your body is not the same as it was decades ago, and understanding these changes is the foundation for doing it safely. 1. The truth about masturbation after 60. The truth is, masturbation after 60 is not something to be ashamed of. In fact, when practiced correctly, it can be one of the most beneficial habits for your health. It helps protect the prostate, keeps blood circulating through the body, lowers stress, and maintains your connection with your own sexuality. But here's what most men never realize until it's too late. Your body at 60 is not the same as it was at 30. The years bring changes in hormones, circulation, and nerve sensitivity. Testosterone gradually declines, blood vessels lose some of their natural elasticity, and nerve signals take longer to reach the brain. Even recovery time after orgasm stretches from minutes to days. I often sit across from men in my clinic who whisper their frustrations, saying, "Doctor, it just doesn't feel the same anymore." And I tell them with honesty and compassion, that's normal. Nothing is broken, but everything is different. What matters now is not denying these changes, but learning how to work with them. Because if you ignore them, what should be healthy and healing can slowly turn into pain, numbness, or even long-term damage. And that brings us to the real danger, 3 critical mistakes men over 60 make when they continue to pleasure themselves the old way. Mistakes that quietly steal away sensitivity, satisfaction, and health. Would you like to know what they are? 2. The 3 critical mistakes over 60 make. Over the past 3 decades of practicing urology, I've noticed the same heartbreaking pattern again and again. Men in their 60s, 70s, even 80s, coming into my office with frustration, fear, or confusion written on their faces. They whisper about changes in sensation, difficulty reaching orgasm, or a sense that their body has betrayed them. And almost every time, when we peel back the layers, I discover the same 3 mistakes repeated over years, sometimes decades. These are not harmless habits. These are mistakes that quietly injure circulation, irritate the prostate, and numb the very nerves that once gave so much pleasure. The first mistake is using far too much pressure and grip strength. It happens gradually. Sensation fades with age, and instinctively, men squeeze tighter and move faster, thinking more force will bring back what was lost. But the penis is not built for crushing force. It is made of delicate erectile chambers called the corpus cavernosum. tiny capillaries that feed them, and a network of nerves as fine as threads of silk. Excessive pressure flattens those blood vessels, injures the nerves, and can lead to something I call pressure-induced neuropathy. Over time, men tell me they can only finish with a grip so tight that no partner could ever tolerate it. I've seen men lose sensitivity permanently, turning what should be a moment of joy into a mechanical, frustrating routine. If you take nothing else from this point, remember, tighter is not better. Gentle touch is the only way to preserve your sensitivity long-term. The second mistake is frequency. I can't tell you how many men come to me proudly saying, "Doc, I still take care of myself every day, just like I always have." They say it with pride, but what they don't realize is that the body at 60 needs time to recover. The prostate is responsible for producing about a third of your semen, and at this age, it works more slowly. Daily or multiple daily masturbation forces it into overdrive, leading to inflammation, swelling, or even contributing to benign prostate enlargement. Hormone rhythms, too, are more fragile. Too much ejaculation can disrupt testosterone balance, leaving you tired, irritable, or uninterested in intimacy with your partner. Some men develop what I call ejaculatory fatigue. Each orgasm is weaker, less satisfying, and leaves them more drained than restored. I've counseled men who thought something was wrong with their masculinity, when in truth, all they needed was more time between sessions. For most men, every 2 to 3 days is ideal, giving the prostate time to replenish and the nervous system time to reset. The third mistake is neglecting lubrication. This is a detail many men laugh off, until they find themselves dealing with painful irritation or repeated infections. As testosterone declines, natural pre-ejaculate fluid decreases or disappears. The skin of the penis also becomes thinner and more vulnerable. When you continue with dry friction, even if it feels tolerable, you are creating microscopic tears in the skin. You cannot see them, but bacteria can find them. Those tiny breaks lead to inflammation, infections like balanitis, and in some men, permanent scarring that reduces sensitivity forever. I've had patients who told me they felt a burning sensation every time they tried to be intimate with their wives, and the culprit was years of ignoring lubrication. A simple water-based, unscented lubricant could have spared them years of discomfort. To me, lubricant after 60 is not optional, it is medicine. Now, I want you to think about these 3 mistakes not as isolated problems, but as parts of a cycle. Less sensation leads to more pressure. More pressure causes damage, which reduces sensation further. Frequent ejaculation drains your body, leaving you with less energy and weaker orgasms, so you push harder to feel satisfied. And without lubrication, every act slowly wears away at your skin and nerves. It is a downward spiral that too many men find themselves trapped in, and the tragedy is that it is entirely preventable. I speak about this with urgency because I've seen the cost. I've sat with men who can no longer feel pleasure at all. I've treated infections that spread beyond the penis to the urinary tract. I've listened to men confess that they avoid intimacy with their partners because their bodies no longer respond. And all of it, every single bit of it, could have been avoided if they had known these truths earlier. But here is the good news. Just as the wrong habits can create a cycle of decline, the right habits can create a cycle of renewal. When you reduce pressure, sensation gradually improves. When you respect your recovery time, orgasms become stronger and more satisfying. When you use lubrication, you protect the skin, prevent infection, and preserve sensitivity for years to come. Change is possible, even after decades of habit. So if you recognize yourself in any of these mistakes, don't feel shame. This isn't about blame, it's about awareness and the chance to do better starting today. Remember, you are not alone. Thousands of men are struggling with the same issues, and thousands more are quietly suffering because no one ever told them the truth. Now you know. And knowing is only the first step. The next step is action. You need a clear, safe, and practical method to replace the old habits with new ones that actually support your health. That's exactly what I'm about to share with you. My proven care protocol, the step-by-step system I've taught to men across America to help them preserve their erections, protect their prostate, and restore their confidence. Are you ready to learn how it works? 3. The Care Protocol for Safe Masturbation After 60. Over the years, as I've listened to men share their private struggles, I realized most of them didn't just need to stop harmful habits. They needed a new framework, a clear set of steps they could actually follow. That's why I developed what I call the Care Protocol. It isn't complicated, but it has transformed the lives of men in their 60s, 70s, and beyond. It's not just about pleasure, it's about protecting your health and preserving your ability to enjoy intimacy for years to come. The first part is cleanliness and comfort. I cannot overstate how important this is. Too many men treat masturbation as something hurried and hidden, done in discomfort or secrecy. But your body responds best when it feels safe, clean, and relaxed. Wash your hands, create a private space, and choose a position that does not strain your back or compress your nerves. Lying down on your side or reclining comfortably is far safer than perching on the edge of a hard chair. When you signal to your body that you are in a safe environment, the nervous system allows blood to flow more freely, and arousal builds more naturally. Next comes appropriate technique. After 60, the days of fast and forceful friction must give way to something gentler and more intentional. Always apply lubrication first. It is not an accessory, it is essential. Use light pressure and be patient with your body. Sensation may take longer, but it will come if you allow it. Vary your grip, switch hands, and think of your touch as a massage rather than a mechanical motion. This not only prevents strain, but also keeps the nerves engaged in new ways, protecting you from the kind of repetitive trauma that dulls sensitivity. Then we move to respect timing and recovery. Rushing is the enemy of satisfaction at this stage of life. Give yourself 15 to 20 minutes and allow arousal to rise and fall in waves. Don't feel the need to force orgasm quickly. And just as importantly, honor the recovery period afterward. For most men over 60, waiting 48 to 72 hours between sessions is ideal. This rhythm allows the prostate to replenish, the nerves to reset, and the body to restore itself. What you lose in frequency, you gain in depth, intensity, and satisfaction. Finally, evaluate constantly. This is the part most men overlook. Pay attention to how your body feels, both during and after. If you notice pain, numbness, swelling, or unusual discharge, don't ignore it. These are signals, not inconveniences. Your body is telling you something, and the sooner you listen, the better your outcome will be. I've seen men save themselves from permanent damage simply because they were willing to stop and ask for help early. The Care Protocol is more than just a set of steps. It is a philosophy of respect for your changing body. It's about replacing shame with intention and replacing damage with healing. And when you approach masturbation this way, you not only protect your health, but rediscover the kind of satisfaction that rushed, forceful habits could never provide. But what happens when, despite following these steps, something still feels wrong? How do you know when discomfort is just temporary and when it is a serious warning sign? That is where we must go next, because understanding the red flags that demand medical help can mean the difference between recovery and long-term damage. Would you recognize those warning signs if they appeared? 4. When to seek medical help immediately. One of the most important lessons I try to share with my patients is that masturbation, even when done correctly, is not a substitute for medical awareness. Your body is always speaking to you, and after 60, those signals become more important than ever. Too many men wait until small problems grow into crises before they seek help. I've had men sit across from me, embarrassed, admitting they ignored pain for months or dismissed bleeding as just a scratch, only to discover it was the sign of something much more serious. I want you to avoid that fate. Knowing when to stop and when to call your doctor can save you from long-term damage, and in some cases, it can even save your life. The first red flag is pain that lingers or worsens after masturbation. A dull ache that fades in minutes is one thing, but sharp, burning, or throbbing pain that lasts longer than half an hour signals something deeper, possibly nerve irritation, vascular strain, or prostate inflammation. Another critical warning is sudden numbness or tingling that doesn't resolve quickly. If sensation disappears or changes dramatically, it's not just aging. It may be a sign of nerve compression or early neuropathy. Changes you can see with your own eyes matter as well. Swelling, unusual discoloration, new bumps, or any discharge should not be brushed off. Especially pay attention to discharge that is yellow, green, or foul-smelling. These are strong signs of infection that require treatment. Urinary issues are another clue. If you suddenly find it hard to start urinating, notice a weaker flow, feel burning when you pass urine, or need to urinate more frequently after self-pleasure, your prostate or urinary tract could be inflamed. And let me be absolutely clear, any bleeding, no matter how minor, deserves immediate attention. What seems like a small streak of blood can be a signal of something far more serious. The last sign I want you to remember is persistent changes in erectile function. If you notice that you can no longer achieve erections during masturbation when you previously could, this could point to early circulation problems or even cardiovascular disease. Remember, the penis is often the body's warning light for heart and vascular health. Ignoring these changes means ignoring your heart. I know many men hesitate to talk about these symptoms, fearing embarrassment or judgment. But as a urologist, I can assure you, we have seen everything. What may feel awkward to you is routine to us, and the sooner you speak up, the sooner we can help you recover and prevent bigger problems down the road. Now, understanding these warning signs is critical, but equally important is understanding why this conversation matters beyond just the physical body. Because behind every medical symptom lies an emotional story: fear, shame, uncertainty, and sometimes loneliness. And if we don't address those feelings, men continue to suffer in silence. That's why in the next part, I want to talk about the deeper emotional meaning of masturbation after 60, and why embracing this part of your health can give you back more than pleasure. It can give you dignity, confidence, and peace of mind. Would you like to hear how? 5. Why this matters emotionally. When I talk to men about masturbation after 60, the conversation often shifts from the physical to the emotional. Many men tell me they feel embarrassed or even guilty for still wanting intimacy with themselves. Some fear that age should mean shutting the door on desire, while others admit they hide their habits from partners or family, worried that they'll be judged. I want you to hear me clearly. There is nothing shameful about this. Self-pleasure at your age is not a sign of weakness or selfishness. It is a sign that your body is still alive, still capable of connection, and still worthy of care. What I've seen again and again in my practice is that men who embrace safe, respectful masturbation often feel more confident in every part of their lives. They sleep better, carry themselves with more energy, and approach their relationships with greater openness. It's not about chasing the performance of youth, it's about honoring the man you are today. Pleasure does not expire with age. Instead, it evolves, deepens, and carries with it the wisdom of experience. I know some of you may still feel uncertain, maybe even uncomfortable with the idea of discussing this so openly, but silence breeds shame, and shame robs you of joy. Talking about this, learning about it, and practicing it safely is an act of courage. It means you respect yourself enough to protect your health and preserve your dignity. So as we close, remember this: masturbation after 60 can either be a slow erosion of your sensitivity and confidence, or it can be a tool for healing, strength, and peace. The choice is in how you approach it. Treat your body gently, listen to its signals, and never be afraid to seek help. You deserve not just to age, but to age with dignity, vitality, and the quiet satisfaction of knowing you are still whole.